Health experts expect many of those metrics, unfortunately, to get worse in January after the virus spread over the holidays.
One major medical institution is now rethinking how to get people to take the pandemic seriously. Monica Garcia says just telling people to wear a mask and social distance, it's just not having the same effect it used to, Monica.
Yeah, Nicole and Jared, all that is still good advice, but the U of A College of Medicine says telling people to social distance over and over again is starting to lose its gravity. So they're now pivoting their message, looking back at health campaigns in the past that worked, like the anti-smoking campaign. Remember that from the early 90s.
Time to breathe life into my creation.
In the 1990s, public health campaigns clearly stated how smoking negatively affected your lungs, like in this commercial from the Arizona Department of Health Services.
You brought me the lungs of a smoker!
All of a sudden, it was harmful. And people really responded in a similar fashion to how they're responding now.
Beth Smith, senior director at the U of A College of Medicine, says the record cases from over the weekend is forcing her team to start to see the battle against COVID from a communications perspective.
What are people missing?
She says in order to save lives, they need to change the perception that COVID isn't that deadly. Much like how the fight against tobacco was won. A turning point that happened when ads started showing the lungs of a smoker. Other health officials in the Valley agree.
I have plenty of colleagues, every time they see someone without a mask, they just want to grab them and bring them to the COVID unit and show them what we're talking about.
Dr. Ross Goldberg, president of the Arizona Medical Association, believes visual aids may be the only way to stop people from continuing to gather in groups.
You can go lots of different directions, some pretty dramatic.
The idea is gaining momentum. Today, this ER doctor from Texas tweeted, "I don't know who needs to hear this, but post-COVID lungs look worse than any type of terrible smoker lungs we've seen." The U of A College of Medicine says it's still in the beginning stages of pivoting their message until the vaccine becomes widely accessible.
They could accuse us of being overly dramatic about it, even though we were trying to tell the truth, because you're not seeing it.
Yeah, and as of today, Arizona ranks second highest for growing COVID cases in the nation. That's right after California. And by the way, that does not include the numbers for when people gathered during New Year's Eve. So it's only going to get worse, say health officials. In Phoenix, I'm Monica Garcia with Arizona's Family.